Hi everyone, Dr. Funke Brown here. I hope you're well. So studies have shown that children with autism, children and adolescents with autism have a lot of sleeping difficulties, and some estimates as high as 50 to 80% of children with autism and as well as adolescents with autism have sleeping difficulties. This is a large number, and so I would like to talk about this today, talk about how we can improve sleep in our children on the spectrum. The problem with sleep in children with autism, the consequences is that they do then have increased behavioral struggles, increased sensory processing issues. You can see them have manifestations of hyperactivity and inattention. And so all those typical symptoms that you would see in a child with autism just seems to be more aggravated. And that causes a lot of stress for the parents and a lot of disrupted sleep for the parents. So when the child is not sleeping, the parent also isn't sleeping. And so really causing a lot of parental anxiety. I would say the relationship is somewhat bidirectional with the manifestations of autism and sleep and the consequences of sleep. So it's one feeding into the other, and really addressing this is important. The most common sleep problems that I see in children with autism are problems with falling asleep. So they really tend to present with delayed sleep onset, staying asleep where they're having frequent nighttime wakings, as well as waking up really early in the morning. In terms of the causes of the sleep difficulties, it's multifactorial, really. So it's anything from the underlying autism, with difficulty with transitioning, with communication problems, with sensory impairment challenges really contributes to their sleep difficulties. In addition to that, they may have underlying anxiety or ADHD, or medical problems like reflux can also affect their sleep. And then definitely something I see commonly as well, obstructive sleep apnea, as well as restless leg syndrome can affect sleep in children with autism. Another thing that we've seen and that's been shown in studies is that their melatonin production is actually abnormal. And remember, melatonin is that hormone that's important for us to be able to sleep. It's the darkness hormone that's produced at night that induces sleepiness. So how do we help our children on the spectrum sleep better? The first thing I would say is addressing any underlying sleep or comorbidities, as you would call it. So if they have anxiety, if they have also ADHD, which is something that can be seen commonly as well in children with autism, or if they have things like reflux and things like that, you want to make sure that that's addressed, because that's going to feed into how they respond to the strategies or the interventions you implement for their sleep. Also, if you're concerned that your child has obstructive sleep apnea or restless leg syndrome, where they're frequently tossing and turning, or they're complaining of leg pains or discomfort, it's important as well to have that treated. The mainstay, I would say, of addressing sleeping difficulty in children with autism are behavioral interventions. And this behavioral intervention, similar to typically developing children, tend to be well tolerated, and they're effective, and they're long lasting. And so the first step in terms of those behavioral interventions is focusing on consistency. So consistency when it comes to their bedtime and their wake-up time is really helpful, because we are creatures of habit. So our bodies anticipate sleep, and our children's bodies anticipate sleep. When we have a set time, both on the weekdays as well as the weekends, where they're waking up and going to bed, that's really helpful for them. The second part is having a routine, a bedtime routine. I am a lover of routines. Again, creatures of habits as humans. Our children on the spectrum also want to be able to know what to anticipate. So in terms of those bedtime routines, we're talking about 2 to 3 calming and relaxing activities that are headed in the direction of the bedroom. Another thing that's important is the environment. So you really want to have an environment that's cool, that is dark, and that is noise free, free from any sensory distractions, especially for our children on the spectrum. So jarring noises or lights and things like that, you really need to try to eliminate at bedtime. Times, again, in terms of those routines and things like that, having them transition may be challenging. So using visual cues, telling a social story and things like that can be helpful. And another thing that can help is actually having a visual chart where you can make it together with your child. You can cut up pictures of, the bathroom, brushing teeth, reading a book. You can get that from online and just kind of stick it on the paper and tick it as you accomplish those steps in their routine. That helps promote engagement, and that helps them really look forward to the next step. And so that's consistency. So focusing on consistency. The second step in terms of those behavioral interventions are limit setting. So our typically developing children, our children that are developing a little bit differently, all want to push their limits, right? That call, that last hug, that last sip of water, that last bathroom break at bedtime, it happens as well. So having those limits set where you say, okay, well, you're allowed, maybe, for example, you could have a bedtime pass or 2 bedtime passes, which is just, you could give them 6 pieces of paper and say, you're allowed 2 bedtime passes. After you use those bedtime passes, that's it. If you don't use the bedtime passes in the morning, I'll collect it from you and exchange it for a treat, for instance. That's something that's helpful, especially for our toddlers and older children that can communicate. The other piece is setting the expectations right from during the daytime with the social stories as well, so they know what to anticipate. Limit setting also is important around those devices, around electronics, around, iPads, iPhones, the TV and things like that. That's helpful for them because it helps their brain also start to wind down for bedtime. And so really at least about an hour before bed, you want to start to limit the electronics and things like that. I would say caffeine as well. I know of many families where they have a little bit of iced tea or Mountain Dew for dinner and things like that. So you want to avoid, caffeinated beverages completely if possible, and definitely after like 1 p.m. during the day, because it stays in their system and it just leaves them really revved up and makes it hard for them to shut down. And then another thing when it comes to limit setting is really praise, a lot of praise. So if you see them following the steps, if you see them doing what they're supposed to do at bedtime, praising them a lot and ignoring negative behavior. So similar to what you would do during the daytime, you can implement those things as well at night. The next piece I would recommend, especially if you're at a point where the child is in bed for a long time and it's taking them hours to fall asleep, and you've put in all these other behavioral strategies, at times we do what you call bedtime fading. So what that really means is that you push their bedtime to be a little bit later, maybe an hour or so. And what you achieve when you do that is that you're helping them to go to bed at a time when they're most likely going to fall asleep. So there's really no point if they're taking 3 to 4 hours to fall asleep for them to just be laying in bed, tossing and turning. So you can move their bedtime a little bit later, and then slowly as they start to fall asleep sooner, you then start to push their sleep time backwards. And then if you've done all that, you've tried all those behavioral strategies, you're sure there's really not a medical problem going on, after discussing with your pediatrician, melatonin, again, is abnormally produced in children on the spectrum. And so that's a medication, usually the first-line medication that we use for children with autism. I mean, it's a hormone anyway, but we use it frequently in children with autism because it's been shown to decrease their sleep latency, meaning that it decreases the time it takes for them to fall asleep. And also it increases the total amount of time they sleep as well. So quite effective, usually a dose anywhere from 1 to 3 milligrams, given about 30 minutes or so before bedtime. It's important to discuss this with your pediatrician as well, just to make sure that your child is okay to take that. There are other medications like clonidine and gabapentin and Melatonin, which can also be used in children and adolescents with autism. But usually when you start to get there, you're either using this with the help of a sleep physician or a developmental pediatrician or your pediatrician as well, just to make sure that your child is appropriate. The drug is appropriate for your child. So those are a few things that I think would help in terms of helping our children with autism to sleep better. Again, in summary, addressing any underlying problem, you know, the ADHD or anxiety or any medical sleep problem, focusing on some behavioral interventions, including the consistency in their routines, consistency in their bedtime and wake time, and ensuring that they have an environment that is cool, that is dark and noise-free, and free of any sensory stimulus. Additionally, working on some limit setting, creating visual charts and making sure that they can follow along, praising them for great behavior, ignoring the negative behavior, using bedtime passes if your child is able to participate in that. And finally, you know, fading the bedtime to later if they're still taking a long time to fall in asleep. And then finally, also talking about medication, specifically melatonin, which has been shown to be safe. So my hope is that this has been helpful. You've been able to get some tips that can help you and your child on the journey towards getting restful sleep. Again, if you have any concerns about any medical sleep problem, or if all else fails, please speak to your pediatrician so that they can help tackle this and help you just walk through what the next steps should be. So I would love it if you like this video, if you share it with people that you in your circle that you feel would benefit from it. Comment and definitely subscribe to my channel so that when new videos come up, you'll be the first to know. And that's it for today. I'll see you next time.